you know, for self-improvement, because at the end of the day, it's for the kids that we're working with. And thank you, Ananya, and thank you, High Five, for once again organizing and allowing me to be here. I'm very happy to be back. I'm very happy to be sharing with you guys today strategies for fine motor skills, but especially for handwriting skills. So without further ado, let's just get right into it. So the plan for today is that we're going to be talking about, as I said, fine motor skills, and we're really going to be focusing on the ones that are important to handwriting. I'll break down a little bit what the skills are. You know, we'll define the skills, and then we'll really try and be as concrete as possible, give you guys some strategies to work on those skills, to develop those fine motor skills. And then we'll kind of break down the components of handwriting, and then again, concrete strategies so that you guys have some tools to work on those handwriting components. So the learner outcomes, I know that you had them in advance. There was a little typo in them. I'm sorry for that. So I'll just make sure that we have them here and everything is clear. So we're going to gain an understanding of those underlying skills involved in handwriting. And I've written skills because mostly we're talking about fine motor skills, but I will mention a little bit about gross motor, a little bit about visual perceptual skills. Then learn some really concrete strategies to develop those skills. Understand components of handwriting, and again, learn some concrete strategies to improve those components, okay? So the handwriting skills, mostly fine, the motor skills, mostly fine motor, that are involved in handwriting. So the first that we're starting with is actually not really a fine motor skill. It's a bit more gross motor, which is why I had brought that up at the beginning, but you'll see how the link is there. So the first thing that we'll talk about is trunk and shoulder stability. And we talk about this because we're starting from the base. So essentially the way that we develop and that children develop is from proximal, or very near to the middle of the body, out to distal and farther from that middle of the body. So what that means is that we're able to control parts of our body that are closest to our center for gross motor, big movements, big muscle movements. And as we gain control further and further and further, we're able to control movements farther away from our body, those fine motor, small muscle movements. So really what we see is that, for example, for a small child, a 2-year-old, we'll see them scribbling and they're really using their whole body, sometimes 2 hands, but their whole body to scribble, their whole arm certainly. And as they slowly learn to stabilize each of the joints in the chain leading to their fingers, so that, well, their trunk, that shoulder, the elbow, the wrist, as these joints are able to be stabilized, they have more and more control of the little movements in their hands. What we see is that a child that has quite weak trunk stability or core stability, or quite weak shoulder stability, they really have a hard time to have any control in the farther parts and any precision in the movements of their hands. So we might see them kind of resorting to leaning or slouching like you see in the picture here. You might see them fidgeting a little bit more because every position that they take, their muscles start to get tired because they don't have a lot of stability and endurance in those muscles. The muscles start to get tired, and so then they fidget to another position where they're kind of relying on a different muscle, and always because of that fatigue, they can't stay in one position. Another thing, we might also be seeing just kind of general poor attention. They're not able to really focus, or they're not motivated, or they don't like to really focus on fine motor type activities or even gross motor activities, and they tend to get tired a little bit quicker. So trunk and shoulder stability is definitely something that we want to keep in mind when we're looking at handwriting. We also want to talk a little bit about grasp, and we'll start with general grasp and then we'll get into pencil grasp. So just like we were talking about big movements, gaining control of big movements to allow for stability and precision for little movements. It's the same with grasp. So as we can, imagine a baby grasping something, it's more of a whole hand movement. And as you can see from the pictures here, as they develop, they're able to gain really stability in the wrist, stability in the rest of the hand, and really just use that pincer grasp that we're always looking for. And I'll just point out now, in this last picture, so at about 12 months, we would expect a child to be able to do this pincer grasp. And this nice position that you see where the thumb and the first finger are touching tips is called opposition. And this is something that we'll talk about a little bit more when we talk about pencil grasps, which is why I'm bringing it up. And what's important to note about this position is that we have this space of the thumb, this space of the hand between the finger and the thumb is called our web space, and we want it nice and open. So you can think open, it's an O shape, opposition, all of those things go together, and we're looking for this formation when we're when we're kind of evaluating or trying to understand a child's pencil grasp. Just as we saw with a general object, I'm just going to ask to make sure that everybody turns off their microphone unless they need to communicate with me. Thank you. Just as we saw with objects, similarly with the pencil, we have a grasp of the whole hand, and we're able to develop to a more precise grasp with just one side of the hand. I'm just sorry, I'm just going to double check it. Does somebody need to communicate with me? Everything's still working?
Notes. And read. Kerri, there is one option. You can unmute everybody from your side. So you can.
Okay.
Mute everyone.
I'm just gonna look for this. 1 second. Can somebody talk me through where I need to go? Oh, I see here. Okay. And I have that setting myself.
Yeah, the host must be having that setting.
I'm not sure that I'm hosting. I think I'm sharing my screen, but I'm not sure that I'm considered a host.
I think it's fine now, Kerri. They all.
It seems calmer now. Yeah. All right. So I'll just remind once more, everybody, that we need you to just keep your mics off because it makes it challenging for everybody to hear. I'm just going to double check. Everybody can see still the slides. Have I mixed that up? Trying to play with the settings.
Fine. It's on pencil grasp, Kerri.
Perfect. Wonderful. All right. So we can continue. Once again, we're starting with the whole hand and we're moving towards kind of a more precise using the fingers and the thumb to stabilize. So we're using, instead of the whole hand, we move towards being able to use one side of the hand. So the thumb side of the hand to hold the pencil, usually the thumb side and a few fingers. And the other side of the hand, the pinky side of the hand, that's kind of tucked in, and sometimes we'll have just the pinky and the ring finger. Sometimes we'll even just have the pinky alone, but we really have this stable side of the hand and the moving side of the hand. And so that's kind of something to be aware of when we're looking at development. Definitely, I'm going to say there's lots of variation in pencil grasps beyond these four that follow still a kind of developmental trajectory. So sometimes it doesn't look exactly like these pictures. But what we're really looking for is developing towards this tripod grasp. And we'll get into some very soon. We'll get into some other grasps that are still useful and can still be very appropriate. But I think it's important just to see these earlier stages because they help you to understand. Sometimes we start to, to panic that a child isn't using a tripod grasp, and so we're placing their fingers in this tripod grasp, but actually the grasp that they're using it is a little bit developmentally earlier, so their hand just isn't developmentally ready. So regardless of the age that you see at the bottom, everybody develops differently. So that's something to keep in mind. If you're seeing really this whole hand grasp or the fingertip grasp, it's possible that you want to be working on some other skills to help the hand be ready for the tripod grasp. Okay. So I mentioned that we'll talk about some other pencil grasps that can also be very mature, appropriate, and adapted for handwriting. And here are 3 pictures of them. So by about the age of 5 to 6 years old, we want to be seeing a mature pencil grasp. The majority of people, so about 50 to 70% of children will use this first grasp, which is the dynamic tripod grasp. So we have our 3 fingers, the thumb, the index, and the middle finger that are involved in holding the pencil. We have the pinky and the index that are tucked in, and we have this nice open web space, the O, that we can see that allows the fingers to move while we're writing so that they're not locked in place. So that would be really the most typical pencil grasp, what we're often striving for. However, some children prefer to have 4 fingers holding the pencil, this quadrupod grasp, and so long as they're in this same position of a nice open web space, they're able to move their fingers, it can be also a very appropriate grasp. And then I've included one other grasp where it can be quite helpful for kids that have a lot of weakness or joint laxity in their, so very like hyper, they're able to hyperextend their joints. Sometimes they can be using this tripod grasp. So essentially, we're still stabilizing the pencil in the first 3 fingers, but we're giving it extra stability between the 2, the index and the middle finger. So it gives a little bit more support, and there's less need to push really hard on the joints and then cause sometimes hyperextension. So that's also a possible grasp that they can be trying out. So these 3 grasps, the reason that we call them mature or appropriate, adapted pencil grasps is because they have a few things in common. So first of all, this open web space is something that's really important to have nice movements of the fingers, so we really get the best precision in the movements and in the writing that we can when we have this open web space. Another thing that we're looking for an adapted for a mature appropriate pencil grasp would be that we have one side of the hand that's actively moving and one side of the hand that's stabilizing. So sometimes what we'll see with kids that aren't developmentally at this level is that even though they're holding the pencil with the first 3 fingers, the other fingers are still a little bit involved. They're not quite in the side of stabilizing the hand. And so then we know that, we need to work a little bit more on separating those 2 sides of the hand. So we're looking for an open web space. We're looking for an active side. The thumb side is active, and a stabilizing side, the pinky side. And we're also looking to make sure that there's no pain or there's no excess pressure in the joints that you can kind of see when kids are pressing really, really, really hard on the pencil. So those would be features of an appropriate grasp. And certainly there's lots of people that don't use one of these 3 grasps here. And that still have very nice handwriting. So I'm not going to say that it's absolutely necessary for everybody to have this grasp. And likely, if you guys look down at your hands, if you happen to be taking notes, if you look down at your hands, from time to time, you're not in one of these 3 grasps, and you're able to function perfectly fine. You're still able to write legibly enough that people understand. Likely, it's not an issue. However, if we're working with quite a young child, especially a child that has some special needs, if we're working with a child that's quite young, that hasn't developed their fixed pencil grasp yet, we definitely would want to strive for one of these grasps if possible, because it increases the chance that they'll have really nice movement of the fingers when writing. So it increases the chance that they'll have good precision. But if you're working with a child that is really fixed, they've already gotten used to a different grasp, and it's still legible, they're writing, they're still able to write neatly, there's not really a need to change their grasp unless there's, you know, pain, unless there's a particular reason. Sometimes, you know, because the speed is impacted, and often it's the legibility that's impacted. But if you don't see those features, you know, pain, legibility difficulty, or speed of writing difficulties, then there's really no need to be playing around with other grasps. If that's not the case, we'll look at some strategies later. So another skill that we want to be looking at in children where we're working on handwriting would be hand strength. Certainly, we want to make sure that children have hands that are strong enough, that they have a good overall grip strength, so to be able to do something like open a jar, for example, in the picture. But also the reason strength is really important is because by having a strong hand, we have stability in the base, and then that allows for precision in the smaller movements. And sometimes when we don't have those strong, you know, those strong hand muscles, what we see is children that are compensating. So they're overusing bigger muscles, but that aren't as precise. The movements aren't as precise. So one example is in this picture here, where we see the child that's, you know, using their whole shoulder and sometimes their whole body to try and open the jar. But another example that relates to handwriting would be that for some children, they don't have enough strength in the muscle that allows them to do that O-O opposition position. And so they compensate with a slightly bigger muscle that pulls the thumb straight in. And so what you see is this, the first picture on the left, this closed web space, because they're compensating with a bigger muscle. So they're tucking or they're wrapping their thumb around the pencil, and it means just that their thumb is kind of in a blocked position and doesn't allow for as much movement of the pencil. So it can still be a functional pencil grasp, and if I'm being honest, when my hand gets tired, I've noticed that I'll resort to that position, but it can definitely have an impact on the quality of the writing, the speed of the writing, legibility, and on pain. Often you're supporting a little bit more, you're pressing a little bit more. So that's also something to keep in mind, and why I was bringing up that web space before. So another thing that we want to be looking at, another skill, is hand dominance. So usually between the ages of 2 and 4, children are developing their hand dominance. And hand dominance is really, you know, when you have a preference and then you've really started using that same hand for all the important precision type tasks. So 75 to 85% of children, of people, are right-handed. The estimates vary a little bit from study to study because different people will measure hand dominance differently or categorize it differently. But so 75 to 85% right-handed, 5 to 10% are left-handed. And then if we kind of think of things as, if we think of it as kind of a spectrum where we have left-handed to right-handed, what we can say is that right in the middle, we would have this ambidextrous. So this is actually quite rare, so maybe only 0.3% of children, where they would really be equally comfortable using either hand for the same task. So they're equally good at writing with the left or right hand. They're equally good at cutting, at throwing, at whatever it is with either hand. You couldn't tell the difference. And then, so that would be right in the middle of our spectrum. And then kind of leading towards this ambidextrous, we would have this idea of mixed hand dominance. So mixed hand dominance would be that we don't only use one hand, but we only use one hand for each given task. So it might look like somebody that's mostly left-handed, so they're writing with their left hand, they're brushing their teeth with their left hand, but they always eat with the right hand, and they're much more comfortable eating, and they're much more, you know, neat and precise eating with their right hand, but always only for that activity. So the importance of understanding about this mixed hand dominance is that sometimes when we see a child, you know, writing with their right hand, but then throwing a ball with their left hand, we start to panic that, you know, the child hasn't determined their hand dominance. But if we understand that we need to be looking at the specific activities, and if we see that there might be patterns within the specific activities, so always my right hand is for eating, always my left hand is for writing, then we can see that it could just be that that child fits under this mixed hand dominance category, and there's not more need for concern. Okay. One thing that's quite linked to hand dominance is midline crossing. So our midline is essentially an imaginary line that divides our body right in half onto to the right and the left sides. And when we're able to cross the midline is being able to bring one arm or one leg across that imaginary line to the other side of the body. Usually kids are developing this skill, you know, progressively between 2 and 6 years old. And it's really essential for all the activities that need two hands. So for things like cutting, definitely for writing, for dressing, for sports, it's really important that children are able and comfortably able to cross that midline. And one thing that we can often see is that for children that do have difficulty, they develop all sorts of ways to compensate. So sometimes it's, they'll reach for something, you know, if they're more comfortable with the right hand, they'll reach for something that's on the left-hand side, but they'll do it by turning their torso so that their right hand can always stay on the right side of their midline. So we need to be watching out for this, turning the torso, to avoid crossing, or also just reaching with the hand that's closest to the object to avoid crossing over the midline. So those are little things to be noticing. Bilateral integration is being able to use both of our hands together. So as we said, midline crossing is really important to be able to do some bilateral integration. And there's different ways that we can use our hands together. We usually start by being able to do something symmetrically. So our hands are moving in the same way together, like banging cymbals or like clapping. Then we work towards having one hand that's the stabilizing hand and one hand that's the worker hand, like if we're coloring, holding a paper and coloring. And then we develop the skill to be able to use both hands for different activities. So something like cutting out with scissors a circle, I have to be turning the page with one hand and cutting with the other hand. So both hands are doing different movements. That would be the most complex. Hand-eye coordination is something else, is another skill that's really important for handwriting. So being able to use our eyes to guide our hands through the tasks, whether it's reaching, grasping, throwing, beading laces into a string, and definitely handwriting falls within that, being able to see the letters and guide the hand accordingly. Dexterity is the word that we're going to use today to talk about coordinating the finger movements, moving objects around within our hand. We can go into many more categories within dexterity. We won't, but essentially these are skills that we really need for handwriting, because they're skills that allow us to move the fingers individually, so dissociating the fingers. And when I mentioned that we need to have a hand that's ready to have one side to be stable and one side to be moving, this has to do a lot with this dissociation. So here we would need to dissociate the sides of the hands. And another part of dexterity is in-hand manipulation activities. So being able to move objects around within our hand, whether it's to have a penny in our hand and bring it to our fingertips to put into a bank, or the opposite, to pick up a small object and bring it and hide it in our palm, to turn it around within our palm, or to shift up and down an object like on a pencil that we would shift upwards or downwards on the pencil to readjust our position. Okay. And then the last skill that I want to talk about, again, is not a fine motor skill, but it's something that's really important in handwriting, and it's our visual perceptual skills. We could have a whole webinar just on visual perceptual skills. There's really a lot that can be talked about. We won't, because we won't have the time. But it's really definitely, they're really important skills in how we capture the information, but mostly how we understand and interpret and respond appropriately to the visual information that we see. So these are the skills that let children recognize differences in letter shapes. These are skills that can be difficult or that can be problematic with children that have difficulty to notice the differences between a B and a D. So reversals can be linked to visual perceptual skills. Also just being able to copy from a model, whether it's from the chalkboard, whether it's from a paper beside them, being able to scan and spot a word, a specific word in the text, understanding the relation between sizes and space, so above, below, side to side, all of that can be really important in shaping the letters, and so it's very important in handwriting as well. And if, while we were talking about all of these different skills, you guys, were starting to question maybe some of the kids that you know or that you're working with, I've included a link to just a general kind of screening checklist that could be interesting. You have a few examples taken out from the screening. This isn't the whole thing, but you can see how they can be linked to handwriting. So just to give you kind of ballpark ideas of what kind of handwriting skills you'll want to be seeing at different ages. So you can see that, at 4 and 5 years old, we're looking for a child that's able to, use that tripod grasp, but maybe not yet with the fingers moving. And then you see a little bit later, 6 to 7 years old, we're seeing that really mature pencil grasp where the fingers are really generating the movement of the pencil. This is not a standardized, it's really just a screening, it's not a standardized test, but it can also, it can still be useful and helpful for just getting an idea of how a child is doing and if you want to be working on fine motor skills. All right, so we're going to move on to concrete strategies. So we'll go over those skills that we just talked about, and we'll look at some things, some games or strategies that you can be trying to improve those skills, okay? So the first one was trunk and shoulder stability. So to be able to work on trunk and shoulder stability, a lot of the activities have to do with putting weight through the shoulder. So any weight-bearing activities, so where we're in crawling position or 4-point position can be really interesting. So animal walks, like a bear walk where the legs and the arms are straight, or like regular crawling, or commando crawling where we're on our forearms and pulling the torso and the legs. Donkey kicks as well, where we have our hands and our feet on the ground, and then we kick up our feet and we take a lot of we take the weight through the shoulders. Yoga, a lot of yoga positions involve that weight bearing through the shoulder. Climbing structures too, so outdoor or indoor parks where we have slides and you can be climbing up the slides, going across monkey bars, rope ladders, anything where we're climbing and putting a lot of weight through our shoulders. Working on vertical surfaces also is a really good one, especially if we want to be working on handwriting, because we can be doing handwriting type activities on vertical surfaces. So that would be working on against a chalkboard or an easel, even washing a window could qualify. So those are interesting things to be looking at. And then also play on the tummy. So in that position where either we're lying on our tummy, so, reading a book and lying on our tummy, where we have our shoulders or our elbows underneath, and we're putting weight through our elbows to prop up our head and our shoulders. But it can also be over a cushion or over a therapy ball, like you see in this, the top picture with that yellow ball. So there's a child that's putting weight through her left arm, and with her right arm, she's putting puzzle pieces into a puzzle. So both arms are working. The right arm is working against gravity to lift up and move those puzzle pieces. As I was mentioning, some different animal walks you see on the left-hand side, the boy that's in this crab position. So he too is putting some good weight through his shoulders. And monkey bars, as I mentioned, or other climbing structures are really good for shoulder stability, and also working on that trunk stability, definitely. Another thing to keep in mind when we're thinking about trunk and shoulder stability is seated posture. So one way to help a child be really stable so that they can have some nice movement in the farther away joints in that chain that we were talking about is to have a really stable seated posture. So think about if your child's feet are, firmly on the ground, if they can have ideally that 90 degree angle between the legs, the upper and well, at the knees, I should say, and then also between the torso and the hips. It can be often it can have a really drastic impact on fine motor skills. Of course, we don't need to have a perfect position all the time. It's not realistic for anybody to be in this perfect position for all of the seated work that they do. However, if we're trying to get an idea of a child's fine motor capacity, if we want to see how good they can possibly be at fine motor skills, we need to put them in the best position possible, so that we've given them all the support we possibly can, and that they're in the best position to be able to show off that nice precision they have at the end of that movement chain in their hands. So just to give you an example, you have a child who is in a nice booster seat so that the table is at a good height for him, but his feet aren't supported. And so he's looking for extra support. He's looking to stabilize himself. And so he's snaking his legs around the chair. Because he's doing this, it's using extra energy for him. So he's doing a lot more work to be able to stabilize himself. And that's energy that he could be using towards the task. So when we're asking a child to stabilize the rest of their body, we're putting them in a position where they really need to be working hard to stabilize the rest of their body. It means that they're going to have less energy or cognitive resources available for the fine motor task, and also for attention. So we really want to be careful about position. For pencil grasp, some things that we can do to help out is definitely explore a shorter and a thicker crayon or writing tool. So on the right hand side, you see kind of the difference. The same child that's using a palmer, the whole hand grasp on a marker, but as soon as we give them a smaller object, he has no choice but to get into his pincer grasp. And it's not, you see the web space is still closed. His hand is not developmentally ready for a perfect tripod grasp, but we're following the developmental sequence so that he's getting closer and starting to use only one side of his hand instead of all of his hand together. So that's a bit why it's important to understand that developmental sequence of the pencil grasp. Another strategy that can be helpful for also teaching, maybe the next step for teaching, having one side of the hand that's the stabilizing hand and the other side of the hand that's the movement hand, is to encourage the child to put a little object in the palm, in their stable side of their hand, and try and keep it there without it falling. So to tuck, in the picture you see a little pom-pom, it could be a tissue, but to tuck something into those two fingers, the pinky and the ring finger, and then encourage the child to try and move the pencil with just the other side of the hand. With some children, especially children where this is new and they're developing this dissociation, the two sides of the hand, they're developing that skill, they might do it for a few seconds and then get fed up and the object will drop. And you can always, oh no, it fell out. You can always try again a little bit. The goal isn't to frustrate them, and definitely it's our cue that developmentally they're still learning that skill. So maybe at the beginning of handwriting we might ask them to do it, to use it for the first 1 minute or 2 minutes, but then we can allow them to put it on the side and color the way that they want. We're just trying to encourage and develop those muscles a little bit, but we don't want it to become a frustration or an annoyance for the child. Another strategy that we can be looking at just to kind of prompt children into using the right pencil grasp Pinch and flip can be interesting. Some kids really get a kick out of it. So essentially, it's having the pencil pointing towards the child. They pinch it, and then they're using just those fingers that we want involved. And then we have them either, you know, flip it or do a helicopter, however they want to do it. Sometimes I do it with noises. So, and then landing the pencil right into that web space. So it really encourages them to have the pencil leaning down. So it's just a little cue for that, to be using that thumb side of their hand. Another option that we can do is with an elastic. And so you have the step-by-step. Essentially what you're doing is tying a little knot in the elastic so that you have a large portion and a small portion of the elastic. The large portion is going around the wrist, as you can see in the picture, and then the small portion is going around the pencil. And so again, it's just a little tug to keep the pencil in that web space, because sometimes what happens is that children resort to that closing the web space using that bigger muscle to move their thumb, and the pencil sticks right up. And what we want is to encourage them to open up the web space and keep their pencil down in that position. And then, of course, there are pencil grips that exist. I would say that it's not the first tool that I'll jump to when I'm trying to help out a child with pencil grasp, but it can be something that we can explore. For some children, it's really genuinely just for comfort. So the first two on the left are more they're just cylinder cushion sort of things. And they're really just, especially for children that are putting a lot of pressure on the pencil, they can be more comfortable. They're not necessarily correcting the position. The others, so from the light blue all the way to the green, those would all be ones that are trying more to correct the position. Some children, when we've taught them clearly, will use them very nicely, but I've definitely seen some other children where they put the pencil grip on and then they go right back, their hand is right over the pencil grip, and they go right back to using their whole hand. So that would be a cue that the child isn't ready to be using a pencil grip. We need to be working more on the small muscles to get them used to pincer grip. Maybe we want to be giving them a smaller crayon to practice just doing writing with one side of their hand, and develop towards more a tripod grasp later. However, I do want to mention that the light blue one with the 3 holes, as well as the red and green one, are all grips that can possibly help when children are wrapping their thumb around or tucking their thumb underneath. So they don't have that nice open web space, because the green and the red one both block the thumb position, and the blue one has really a special place, you know, a little hole just for the thumb. So if a child enjoys them, if they know how to use them well, it can definitely be something to explore, but it wouldn't be my go-to in every situation, a pencil grip. So for children where we see that maybe their hand just isn't quite ready to be in that really nice open opposition position, we can definitely be working on pincer grasp and on overall hand strength so that they have the stability there to be able to do some smaller movements. And we can work on this in many different ways. So you can be doing activities with little tweezers or with bigger tongs. There's games with tweezers. Operation is one. Here you have a game, Bed Bugs, that also has little tweezers. Using a squirt bottle or spray bottle is also a good hand strength activity. Using hole punches, so there's some that are quite large that take more hand strength, and some that are smaller, like in the picture here, that would really be working more on that pincer grasp. Popping bubble wrap is a really good one for pinching, and we can even be doing different fingers at a time, popping with different fingers. Cutting is a fantastic one for developing hand strength, and it can always be cutting something thicker like cardboard or a folded piece of paper. Peeling stickers is also a good one for pincer grasp, and it takes a good amount of strength. Any of the activities where we have to spin or twist a small object, so like twist up toys or spinning a top. Using clothespins, whether it's actually to hang up clothes or to hang up cards or to pick up pom-poms, that can be really interesting. Modeling clay or therapy, where the child is really manipulating and squeezing. Using a peg board or a game that has the concept of a peg board. So you have in the picture Perfection, which are little peg puzzle pieces. There's also Light Bright is a good pegboard game. activities where children need to screw and unscrew, whether it's kind of tool, pretend tool activities, or just opening a bottle is a really good hand strength activity. And also the last one you can see in the picture is the tennis ball monster. So essentially it's a fun little game where we have a tennis ball and we cut a hole, a line in the tennis ball. And so the child needs to squeeze the ball open to insert little objects into his mouth. And you can use a die to roll a certain number of objects he has to get in his mouth. So it's a good two-handed bilateral activity, but also you have that hand strength. For working on hand dominance, I kind of wanted to walk you through a little bit my thought process when I'm looking at a child and wondering about their hand dominance. So first thing I would do is observe the child for a few days or maybe even a few weeks, and I would give them everything right at their midline and really just observe which hand they seem to be preferring. So when I put their pencil or their spoon or their toothbrush right in the middle, do they tend on first instinct to go more with their right hand, or do they tend to go more with their left hand? If I see that the child is always starting with the right hand, but then after a little bit of doing the task, brushing their teeth a little bit, oh, then they switch, or coloring a little bit, oh, then they switch. Then my thought process is, I wonder about their hand strength. Is their muscle endurance enough that they're able to finish the whole task? So a child where I really see it's consistently the right hand or consistently the left hand first, I would really try and encourage them only to use that hand so that we can develop that endurance and build up that strength. However, if I'm putting an object in the midline and I see often it's just the closest, the hand that's closest, or if it's right in the midline, it could be under any hand, then I would start to wonder about midline crossing and about bilateral coordination. So if it's that really, an object is on my left side, even if I'm right-handed, I'm more comfortable. I would prefer to have that pencil in my right hand. It's harder for me to reach across my midline than it is for me to just give up and use my left hand. So then I'll continue with my left hand. If that's the case, then really what we need to be doing is practicing that midline crossing and practicing activities where we're using both hands together. So to work on midline crossing, we can be doing activities like washing a board or a table and putting things on different sides of the body to wash or to erase. Drawing on a big piece of paper or drawing on a chalkboard, especially activities like drawing that figure 8 or even doing a figure 8 in the air, drawing rainbows, but where we're really getting one arm across the midline and over back to the same side. There's a whole bunch of action games that have midline crossing, things like clapping games where we're crossing across our body. Simon Says, it can be, touch your right elbow to your left knee. A lot of also yoga positions involve midline crossing of the arms or of the legs. There's certainly programs like Brain Gym that emphasize a lot midline crossing. I won't say that one activity is better than the other. If we're working on midline crossing, we want to be doing a variety. And I'll just mention, again, the compensations that we want to be watching out for is avoiding using the torso and avoiding actually crossing the midline when we're doing these activities. So another thing to be working on if we have a child that hasn't quite chosen their hand is a lot of bilateral coordination activities. So activities where we're using two hands, and it can be using two hands together for that symmetrical movement, like rolling out some chapati dough or roti dough or Play-Doh. It can be also things where we have a stabilizer hand and a moving hand, like a lacing card, or like one of these games. So Pop-Up Pirate, as you see in the picture here, is a game where we have to hold the container and insert the swords. Mr. Potato Head is the same sort of idea where we hold the potato and we insert the pieces. So we have that stabilizing hand and the moving hand. Stencils as well are really good for that, having a stable hand and then coloring inside the stencil. For hand-eye coordination, activities where where we need to kind of follow a trajectory. So mazes or dot to dots where our eyes need to be kind of checking in with where our hand is going. Buttoning is a really good one as well, because we have that really precise slot that we need to stick or hole that we need to put the button through, sort of like the coins in a slot, or this Connect 4 game. And activities with lacing or beading are also really good, where we have a really precise bead or hole that we need to insert the lace into. For dexterity, activities that we want to be working on are collecting or dropping one small object at a time. So in the picture here, the child has a bunch of beads in their hand. They're holding the beads in their hand, and then they're inserting one at a time into the bottle. And it can also be the inverse, where she's picking up one at a time and collecting them into her hand. Another game that's really good for this is that the game of, having mystery objects in a bag, reaching the hand in and trying to feel what the object is. It really encourages a lot of movement in the fingers. Finger puppets is also really fun, especially for having that active and stable side of the hand. So really finger dissociation or hand dissociation. So I might have, the horse on my thumb, and then I'll say, oh, the chicken wants to talk to the horse, and they might talk. Or, the cow wants to wave hello, and the child has to move just that finger. So that can be interesting. Games where we need to be really precise, like pick up sticks in the picture, shuffling cards as well, and then just general pencil movements. So for example, rather than taking a pencil with one hand and placing it perfectly in my hand, I want to be able to collect, spin around, erase, spin back around, move up and down my pencil. I want to be comfortable with all those movements to be able to do some nice handwriting. And then the last area was visual perception. And so activities to work on visual perception are especially copying type activities. So I could be copying patterns of popsicle sticks, like you see in the picture with different colored sticks. So I do one set, and then the child has to replicate how the popsicle sticks are. There's also pictures that you can be copying from, blocks. There's all sorts of games where you have to copy block positions, but it can also just be that you build a block tower and they have to build the same one, the same colors, the same orientation. In a pegboard, it can be copying patterns of blue, red, for example. Step-by-step drawings is also a really good way to work on visual perceptual skills, where the child has to, notice the differences from one step to another, see what's been added, and then copy in the same orientation, the same size, copy what they're seeing. Puzzles are fantastic visual perceptual activities. We have, the ability to kind of scan through a busy environment of many puzzles. We have the ability to kind of imagine turning the object, or actually turn the object and imagine where, or the piece, and imagine where it could fit. Similarly, in word searches, or those puzzle picture books like I Spy or Where's Waldo, we have to be able to scan a very busy environment and find specific information. And shadow pictures is this picture that you see on the left-hand side, where children are able to match, when they have just the shadow of an object, they're able to match it with the actual object. So they're able to see the similarities in that contour. Okay. So we've made it through all the fine motor skills. We're going to get into a little bit into the components of handwriting, and then give you some strategies for that. This is really to be able to break down the strengths and the weaknesses in writing, and to give you something concrete to be working on. So the first thing that we'll talk about is letter formation. So this is the ability to really follow the steps to form each letter. In general, we're talking about starting from the top and moving to the bottom. So lines starting from top to bottom. And that when we're doing letters like the letter A, we're doing it in a counterclockwise motion. And I'll say that certainly people can have very neat handwriting and not use typical letter formation. So it can certainly be legible even with a different formation. But if we're having legibility problems, I would definitely take a look at handwriting letter formation. So in the examples that you have here, you see for the letter H. So in the word the, you have the letter H, which is second. So here we have a child that hasn't understood that the movements follow one after another. Either they haven't understood this because we have a segmented H. We have the line and we have the kind of the bump. Either it's that they haven't understood that they're connected, or that the child isn't using a proper, they're using kind of an atypical movement. So maybe they're starting at the bottom, they're moving up, and then they find themselves up at the top of the line, and they don't know how to get back down to do the rest of the H. So some people are going, some kids are starting at the bottom, going up, down, and then their little boing movement, or sometimes we see this segmentation. So that can cause extra lines or kind of segmenting of letters. And another, with the clockwise, counterclockwise, is the question of where they're starting their circles. And so you see in the picture with the A that the child hasn't started their A circle at the appropriate place. And that means that they're too far left when they come around to be able to continue their letter. So they have to add a little extra loop on the top of their A. So this really could be fixed if they were starting at the right place. And similarly, we see with the D that again, they're doing their counterclockwise, clockwise, or else they've just started in a poor place so that they finish again on the left-hand side and they can't get over to the right-hand side to do the second piece of their D. So letter formation is definitely a key component in legibility. And it can be really important in handwriting, in cursive writing, because if I end at the top left-hand side, if I end writing my letter there, then it's very hard for me to attach the next letter on the right-hand side. So it's worth exploring. Another component of handwriting is the alignment of the letters. So it's really respecting the appropriate position of the letter on the line. So on the right-hand side, you see kind of three categories of letter alignments. We have letters that are quite tall, so they fill the space between the two solid lines. We have letters in the green that are small, so they fill the space only between the dotted line and the base line. And then we have letters that fall underneath the line, and so then they start on the baseline, but they have a part that dips under. Some children don't understand these distinctions, and so then what happens is we get something like the SED, so in the word used, the SED are kind of floating up above the baseline, whereas the Y is not dipping down underneath the baseline, so it almost looks like a capital Y. So that can be problematic if the child doesn't understand the alignment rules. For sizing, we're looking at really a consistent size of each letter. So if we take, for example, the E and the R in the word teacher on the second line, they're not well aligned, they're floating up in the air, but they're about 1 square large on this graph paper. Whereas if we look at the F letter, it's really big, it's almost 6 squares large. Of course, the F should be taller than the E and the R, but only double the size, not 6 times the size. And definitely we want to see that the sizing is adjusted to the space that's available. So in fact, often when we give a child graph paper like this, the expectation is that they're writing 1 letter in each hole, and clearly or in each square. Clearly that's not realistic for this child. So we want to be thinking about giving them lines that are realistic and achievable for them. So maybe a little bit bigger than definitely bigger than these squares, and maybe a little bit bigger than typical lined paper. And then the last component of handwriting is spacing. So really having a consistent space between the letters in the same word, but also between words and between lines. So sometimes we see letters touching together or almost on top of each other, or we see spaces in the word that are so big that we think it's a new word. Between the words, sometimes we see a bit like in this example where it just looks like a mass of letters all squished together. There's no space between the lines, no space between the words. So when we see something crowding like this, we start to think spacing might be something that we want to be working on, okay? All right, and so the last chunk is to talk about strategies for developing these handwriting skills, okay? So for letter formation, there's a bunch of programs, pre-made programs that really go through how to teach letter formation to children and go through other components of handwriting as well, I'll say, but especially for letter formation. So Handwriting Without Tears and First Strokes are both programs that are really focusing on having multi-sensory information and teaching letter formation and handwriting in a multi-sensory way. So there's songs and sounds that go along with different movements. They really break down the movements. They're using different media, so chalkboards and sponges and things like that. Sometimes there's objects to manipulate to build the letters. So those are programs that really use this multisensory approach. And then Printing Like a Pro is another program that uses more of a cognitive approach. And we'll get into some of the strategies of that as well. But they're all developed by occupational therapists. There are also many programs that are developed by teachers and special educators that are also really fantastic too. And you'll, just so that you know, you'll have the links at the end towards these programs if you're interested in exploring them more. So just to give you some general ideas of these multisensory type approaches, I would encourage you to explore with the child writing in different media. So writing, like you see in the left-hand side, in shaving cream, in finger paint, having a tray of rice or sand and writing letters in that, writing, you know, fogging up the mirror and writing on the mirror, using chalk, using all different, you know, pencils and markers and all different things. Another thing that you can explore is just having the child practice tracing the shape of the letter. So it can be a guessing game where you're tracing letters on the palm of the hand back and forth. It can be tracing in the air. It can be taking a car and tracing the trajectory of each letter. In the picture on the right hand side, you see a child that's tracing the letters of their name in stickers. It can be or in glue or in glitter. And another thing you can be exploring is practicing forming the shapes of the letters, forming the letters, but without using paper pencil type ideas. So with using blocks or using, you know, modeling clay or using wax strings. So just a piece of string that has some wax on them. There's different brands. Wiki Sticks is one of the brands where you can kind of bend it and shape it to the letter that you want to be practicing. So I'll show you guys a little video here. So this is a video of a girl who's practicing using this multisensory strategy. It's actually a strategy taken from Handwriting Without Tears. And with an extra kind of another program strategy thrown in. You'll see the first thing she's using, the strategy is called wet, dry, try. So first she's using a little wet sponge, which is cut quite small to practice that pincer grasp, and she's tracing the letter on the chalkboard with that sponge to make it wet. Then she takes, I call it her ghost finger, so she takes a little tissue and she covers her finger with that tissue to make a little ghost finger, and then she traces the same trajectory with her finger and the tissue to dry it off, and then she tries the letter herself with the chalk. And I'm also giving her sound cues about the shape of the letter. So for her, we're using, it's actually a French program that we're using called the ABC Boom. But so I'm saying took for dropping the line down, and then boing. And what you'll see is that because she's practicing a few times, the first time she isn't starting at the top and dropping down. The first time she's doing that kind of repetitive back and forth before she finds the right position to go into the rounded part of the R, and as you see, she practices and she is able to get it by the end. So let me just show you guys this.
Right, so this is Layla doing wet.
So there she's gone backwards.
Dry with her ghost finger. Tuk.
And there she understood she had to start at the top.
Try
Tuk,
with
boing.
her chalk. Tuk. Boing.
Okay.
Beautiful.
All right. So multisensory is definitely one strategy that you guys can be exploring for practicing. For practicing handwriting. I'll just ask you to keep muted, please. Sorry, I'm having an issue with mine as well. Sorry about that, guys. I'm just trying to get my notes up and showing as well. So that's definitely one strategy that you can be trying. And then the cognitive strategy would be another strategy that you can be exploring. And the cognitive strategy would really be using a little bit more self-talk and memory strategies. So having visuals so that we see the numbers and the arrows that go along with the letter formation. So we have, you know, for the letter A, we have the little arrow that's pointing in a counterclockwise way, and then the second arrow labeled 2 that points down. We also have that little script that you see on the side. So it says around, close, and down. And so then they practice doing those movements and repeating that script. And then the other thing that's really important in this cognitive type strategy is that as much as possible, we're working on the actual task. So as much as possible, we're getting time practicing handwriting on paper, doing regular handwriting type activities. So that's also something definitely to make sure that we're balancing and that we are really focusing. Of course, it can be helpful to work a little bit on those fine motor skills, but we want to make sure that if we want to work on handwriting, we're really practicing actual handwriting as well. For alignment, there's a bunch of different strategies that you can use. Definitely one thing to try out that's quite easy and quick is just to highlight the baseline and the top line so that the children really see clearly how big their letters should be. But another thing, as I had mentioned before, is teaching the children about different categories of letter alignment or letter sizes. So there's different programs that use different words. I was talking before about tall letters, small letters, and fall letters, and you can kind of see the categories in the picture on the right. I've also worked with a program where they divided it by ground letters. So letters that kind of, as you see in the top right, letters that would be in that grass area. So all of those small letters like A and B and E. Sky letters that would reach up into the blue sky portion of the lines. So like the capital letters and the B. And then ground letters that dig down underneath the ground into the brown portion like J and G, for example. Okay. And as for spacing, something that can be really, really easy, but super key is to make sure that we have really clear cues so that we're really giving a clear amount of space. Sometimes we see really poor handwriting when we just give the child a blank paper and they have to kind of invent the lines themselves. So we want to make sure that we have line space, or graph paper can also really be helpful because it has a very clear cue on how large the letter should be. Another thing that can be helpful is having some sort of finger spacer or teaching the child to use their own finger as a spacer and really have them practice, as you see in the picture, putting that spacer between two words to make sure that they have a very clear space between words to separate the words. Okay. So that is it for handwriting components. That is it for the presentation. If you have questions, I am happy to take them now, or comments as well. You have the bibliography here, and then as I mentioned, you have some other useful resources. So the different programs that I mentioned. I didn't mention, but Printing Like a Pro is a free online available program that you can download completely with all different worksheets. So if you're interested, check out that website that's there. And then there's a bunch of different blogs and websites of different occupational therapists that are talking about handwriting skills that can also be really helpful to you. So I hope that that gives you a place to start for handwriting, and I am ready for your questions.
Thank you, Kerri. Can you stop your share now so we can see you in full view?
I'm stopping it, sorry.
Oh, that's okay. Okay. So
Has it stopped now?
no, not as yet.
No. Oh, here I see. This is what's wrong.
Okay,
there we go.
Thank you. Okay, the first question comes from Mehak. She says, can you talk a little about the wrap grasp?
The wrap grasp, yes, where the thumb is wrapped around.
Is that a mature or adapted or inappropriate or dysfunctional?
Okay. So what I would say is that when we see this grasp, so I mentioned that I am guilty of resorting to this wrap grasp sometimes. When we see this grasp, what it causes is that we have a little bit less movement possible in the fingers. So when my thumb is wrapped over or pulled in, it's harder for me to move the fingers really fluidly. So if I have this wrap grasp and I have really poor legibility, or I have pain in my hand because I'm grabbing too tight, then I might try and work on the child's developing another grasp. It might not be that 100% of the time they'll have another grasp, but even just being aware that sometimes we can check in and, have the web space open, and I'll teach them really about, open web space, what it does to their fingers. I'll have them practice, writing with it open, writing with it closed, and seeing the difference in their writing. I would say for a child where it's very fixed, because usually once we've gotten to the point of having a grasp like this, we're starting to get to quite a fixed grasp. If we have a child where it's quite fixed and where their handwriting isn't problematic, then I would say it's fine. Let it go. I live my life where some of the time I'm in wrap, thumb tuck or thumb wrap, and my handwriting is still everybody that I'm writing to is still able to read, so it hasn't caused a functional implication in my life. However, if that's not the case, then I would really educate the child if they're available to learn about it. I might kind of try and build up the muscles, so the pincer grasp muscles, so that it's a little bit easier for them to move back into that position. So it might just be muscle weakness. And so they try in that position, they write a little bit, and then their hand gets tired and they move back. And also I would say, check out the posture of the whole body, because sometimes it's just looking for more stability when the rest of the, when we're in a funny position or the rest of the arm isn't stabilized. Okay. So it's not that it's a maladaptive, a terrible hand grasp. It's not the most ideal, but some people get by perfectly fine. And I would say there's a good number. I don't have data on how many people do it, but it's common enough, I would say.
So how do you check on dominant hand?
Okay.
I'll just continue the question.
Yes, sorry.
Together. A 3-year-old child can write but does not like to do the tracing. Should we stop mixed hand dominance? I think it's multiple questions come together.
Okay. So if we're saying hand dominance at 3 years old, so if we see a child and we happen to be working on tracing, like the question was mentioning. So if we see a child at 3 years old where they're really, within the tracing task, they're really trying either hand anytime, it's really not clear. What I would say is, honestly, at 3 years old, it's not a huge problem yet. We're not at the age where it's a big, a big concern. However, I would start to kind of try and monitor in a more structured way. So what I would do is I would start giving objects, always placing objects right in the midline. So if I want to give the child their crayon, it's right in the middle of their body. If I want to give the child their pencil, their fork, their toothbrush, whatever it is right in the middle of the body. A ball is right in the middle of the body, and just kind of observe what is their first instinct. So if we start to see a pattern there, then we can start to encourage them towards that hand. Okay. But if we don't see any pattern, then what I would really encourage is that you look into midline crossing. So is the child choosing whatever hand is closest to them? The pencil's on this side. Oh, today I'm right-handed. Oh, the pencil's on this side. Today I'm left-handed. If I'm seeing that, then I would want to be working on getting the child really comfortable with bringing their arms across the center of their body. and working a lot on two-handed activities. So a 3-year-old can be doing two-handed coloring for, you know, in a playful way, or two-handed, you know, playing in shaving cream. They can be doing activities where they have to pick up objects with 2 hands. They can be doing, you know, holding something and putting objects inside. So really having those 2 hands working together so that they get some experience with having one hand that needs to have a little bit more of a refined movement and the other hand that's a little bit more in a steady movement, and they can start to explore with which one feels better and start to get that, develop that preference. Okay?
That makes sense. Makes a lot of sense.
Super.
Okay, let me just get you the next question. Children transfer object from one hand to another hand instead of doing a cross midline.
Yes, that's fantastic. That wasn't even a question. That was just an excellent comment to say, to talk about another avoidance strategy for midline crossing. That should be in my presentation. I'll write it down. Absolutely. So in addition to looking out for that torso turn, so if I have something on the right hand side, but I prefer my left hand, well, I might, you know, turn my torso and just go with the right hand instead of crossing over with the left. The same thing we can see. Another sign that a child is avoiding midline crossing would be there's something on the right hand side. They want to bring it over to the left. Well, they'll give it to this hand and they'll put it in. So those are 2 things really to be watching out for. And thank you so much for bringing it up, because that definitely needs to be mentioned.
And so we obviously do the midline activities.
So that is my cue that the child is avoiding. Sometimes it depends on the specific task. Sometimes there's reason to be transferring objects, but I would say it's a very strong sign that we want to be looking at midline crossing. Yeah.
So from your experience, do we do cursive writing with children with developmental delays? Should we start with lowercase or uppercase alphabets? What is easy for children with special?
So definitely there's a lot of variety in school programs, and there's not, sometimes it's difficult to do something outside of those school programs. But in the ideal world, I tend to encourage printing before cursive writing, because the precision of movement that's needed for cursive writing is quite refined. So we're talking about needing to hold the pencil well and then really have fluid movements of the fingers. And we were saying 6 to 7 years old to really have that good dexterity and good fluidity in the dynamic movements of the pencil. And usually before 6 or 7 years old, we're starting to introduce handwriting. So I would often encourage printing first. I would encourage, just because the shapes of the letters tend to be easier, I would encourage capitals before small letters. If we just think about like the developmental sequence, you know, we learn big to small in our movements, and we learn similarly in capital letters, and capital letters tend to have a lot more straight, some diagonals, and some curves, but more of the straight, you know, horizontal and vertical lines that are a little bit easier. So I would encourage that. To address the question of should we teach, you know, what should we teach to children with developmental difficulties, there's some variety. So just because we teach printing first, I wouldn't say it means that we don't teach cursive. For some children, it's cognitively overwhelming for them to have 2 separate ways of writing. But I would argue that for children where letter formation is really tricky and coordination is really tricky, I have seen children where we switch to cursive writing, and because they're forced to shape their letters properly so that they end at, you know, the right bottom corner of the page, it makes their writing neater. They're forced to do appropriate letter formation, and it makes their writing neater. Not with every child. With some children, you see them, you know, lifting up their pencil and adding in little things in their cursive, but it's maybe something to explore if you're working with a child where even in printing, it's very difficult for spacing and for forming the letters. There's no 100% rule for me. It depends on the child. It depends on, you know, a quite thorough analysis of what their strengths are. But I wouldn't say that I rule out either printing or cursive. And I would say that in general, my rule is printing and capitals first. Other people might argue with that, and there's definitely different ways of thinking of things.
And I know this is always an argument.
I know. I
There's
know.
one more argument. How do you teach in 4 lines, which is divided 2 blue and 2 red lines? 2 red lines and 2 blue lines.
Where we have solid lines?
Yeah, yeah.
Okay, so
4 lines.
So it's possible that I don't know exactly what you're talking about, because I've come to realize that every country uses their own paper. In Canada, we have French paper and English paper. In Warsaw, Poland, where I find myself now, they have other paper. And I'm not sure that I know exactly the paper that you're talking about, but I would say that we would have one line so we would have the baseline. Underneath the baseline, I would have another line.
So you have two baselines where the normal letter rests. So your A, C, and D.
Mm-hmm.
Have the upper line, which is the red line, which
would sometimes be a dotted line in other writing.
So it's not dotted; it's colored. So there are 2 lines with 2 red lines. So what happens is it's very confusing for your child. Which is the next line? Where does the next red starts? You know. So So in India, we've been facing this challenge, and we've been after the school system to start. Yeah. So
let me just. I need to go a little bit bigger on my screen to be able to see.
So is 3-line a better option, or a 2-line is a better option?
So I think it's hard for me to answer, because I haven't worked with that issue with a child. But definitely, regardless of what the lines look like, if you know where the letters are supposed to be, I would give the child really clear cues. You know, these letters, so my A, E, I, O, U, M, all of those small letters are supposed to fit between this and this line. And you can give them, you know, they sit on line number 2, I guess, right? Or number 3. 1, 2, 3. They would be sitting on line number 3.
Did you realize how difficult it is?
So to picture, yeah, I can imagine, you know, adding more lines to the mix doesn't make things easier. But so I would really teach the kids, and you can put little prompts on the picture. So even within the 4 lines. So even if you take the examples that I talked to you guys about, so you know, the tall, small, or fall letters, or even the grass, sky, ground letters, you could still use for 4 lines. You would still have, because all letters, you know, are scaled to how can I say this? All letters are made where 4 lines are important. However, sometimes the 4th line would actually be the first line of the line below. But you're still using 4 cues. So for the sky, grass, ground letters, I would still have the sky would be my first letter, and between the sky and my first line, between the sky and the grass would be my 2nd line, then my grass to my ground would be my 3rd line, and then my ground to the bottom of the ground would be my 4th line. So the principle is the same. You just have more colors and more lines to confuse people. But so you can still use those same prompts and just change the dotted line to be a straight line, and show the children that, you know, 4 lines is consistent with this, you know, sky, grass, ground, or this tall, small, fall letters. But I would just break it down for the children and have them practice, you know, which letters fit between, you know, and highlight in between the 2nd and the 3rd line, highlight there, which letters fit here, perfect. And then highlight between the 1st and the 3rd line, which letters fit here, and then highlight, you know, between the 2nd and the low line, which letters fit here, and have them really make sure that they understand where each letter falls. I hope that answers the question, and I totally understand where you're coming from, because even to explain that is confusing.
So Mehak wants to know which was the program that had the ground and the grass and the sky letters.
I know it from a French program that I use called ABC Boom, which I didn't put because all the prompts are in French. But if you look up, so that picture that I found where it was grass, sky, ground, I just Googled grass, sky, ground letters and I found different visuals. So just because it was in that program, I'm not sure who made that. I don't know if this ABC Boom program that I worked with were the original source for those letters. To be honest, I'm not sure. That's an excellent question. But if you Google it, you can definitely find resources and maybe you'll be able to find the original source.
So Samvedna has the question, how do you work on reversals?
Okay, so definitely, as I mentioned, if I'm concerned about reversals, I'm thinking about visual perceptual skills. So I want to make sure that the child is able to notice differences. Of course, we want to notice differences between letters, but even before that, can they notice differences in pictures? So are they good at those, you know, spot the difference pictures? Can they compare two things and see when one is different? So worksheets like that, or copying a model, step-by-step drawing, are all working on the challenge of noticing differences. And then another thing that we want to be making sure is really solid is spatial awareness. So do they know that when something is to the right side, you know, when a D has the circle to the left side and a B has a circle to the right side, do they know this right and left? And when you're teaching those different letters, you can give cues like that, you know, if they know left and right, or cues, you know, if they're working always on handwriting in the same environment, you can say, oh, a D, the bump of the D goes towards the door if that happens to be where you're working on it. So you can definitely be giving cues related to the environment if it's a consistent environment. You can definitely be practicing noticing differences and things like that. And then for the specific letters, often it is specific letters that are getting reversed, there are some really specific tools or strategies that you can use. So you can find some online as well, but a very common one is B and D. And I'm concerned that when I do this for you, I'm not sure, but I'm concerned that every time I refer to my right side, it's for you guys on the left side of the screen. So this whole time that I've been drawing my A's and everything, you've been thinking that I'm drawing them backwards, haven't you? That must have been very confusing for you.
We've been getting it. It's okay.
All right. So I don't know if you know of it or if you've heard of it, but there's this there's different little rhymes that go with it, and the one that I tend to use is bed. So I have the child, and they have, if you Google this as well, bed, BD reversals, you'll see visuals. But essentially, if you take the word bed, you have both a B and a D in it, and so then you can have the child, and if the child knows that you have to read from left to right, which can be another obstacle, and you have to work on that. But if they do know that, and I should say from left to right, then by holding up their hands, they can think B, E, D, and know that. It's funny for me because it's wrong what I'm showing you, but I think for you it's right. Know that this one would be the B and this one would be the D. So there's different little tools like that, and there's, for some people do B, E, D and P, E, G. And then the P and the G you also have. So I like that one just because the child doesn't, once I've shown them the visual, they know it already, and they don't need a picture. They just have their hands and they can do it themselves. So that can be a possibility.
So we have a lot of questions, so I'm just bracing.
Okay. I'll try not to give such long explanations.
Okay, so Sonali has a question. Her son has a grasp that he does not get enough pressure while writing. Can you please strategies?
Yes. I thought, it's hard to make these presentations, and I was like, too much grass, too little grass, but I knew that we wouldn't have time to get everything. So what the problem is that there's not enough pressure being put through the pencil, insufficient grasp. Okay. So, one thing that I would explore is, does it have to do with muscle strength? Do they have the muscle strength to be able to push harder on the pencil? And so definitely you want to be looking at those hand strength activities. You want to be looking at the pincer strength activities. You also want to be looking at trunk and shoulder stability activities, definitely. But when you do you also want to be working on handwriting and teaching them handwriting. So there's different things you can do. You can sometimes try and compensate and just give them a marker or give them a really soft pencil or a felt pen so that you can see the letters, so that at least, you know, they're making such a big effort to write nicely and we just can't see it. At least we're able to see. But also be working on developing those skills. You can do what do you call it, where you put different objects. Sometimes I put pennies, or sometimes they have really plates that you can color over, and like crayon impressions is what I call them. And take a crayon and you have to color really quite hard, and you have to put a lot of strength into it and kind of be able to see the bumps that come up on the page. So that's a really good activity that I often do for kids that aren't pressing hard enough. Also, those like lottery type coloring activities where they have to scratch off the black to be able to see a colored picture underneath. So that could be another really good activity, and give them a pencil and have them practice pressing hard. And also
giving them smaller crayons and smaller pencils to do.
Yeah, you can explore and see if different pencil like it might just be the way that they're holding the pencil. So you can explore and see, are they holding the pencil in the most stable way? Have they got enough stability? And if it's that they don't, then maybe we want to be using something, definitely bigger. We'll go back a little bit in the developmental progress of hand strength and try and, you know, see if I give them something that they can hold with the tips of their fingers, is that a little bit easier? And another thing that I'll do with some kids is really teach them a little bit like that 5-point scale that we were talking about before last week in self-regulation. I would teach them a scale of pencil pressure. So, you know, we have really light pencil pressure, and that's like ghost writing. And then we have a little bit, you know, just right pencil pressure, and that's kind of in the middle. And then we even have too hard pencil pressure, and I'll do, you know, different activities where we fluctuate between them to help them gain a little bit more awareness of that pressure.
Excellent. And if you go completely the opposite?
And so that's why I mentioned this game of self-regulation of pencil pressure, because completely the opposite, I would still use that game. I want them to be aware of the differences in terms of compensations. Like if I just want to give the child some motivation to keep writing, even though it's really hard, I might compensate by giving them by not giving them a pencil that's really soft. I would give them, you know, and not giving them a lead pencil, because it's really frustrating for them when the pencil breaks. So I might compensate like that. But if I want to start giving them cues, when a child is doing really hard pressure, I want to try and help them notice that they're pressing too hard, and then learn how to relax. So I might do some hand strength activities, but also some hand relaxation activities. So squeeze and then relax your hands, and feel your hand can be loose and you can still hold the pencil. So teaching them a little bit that, so that they know what they can do when they notice that their hand that they're pressing too hard. And also talk them through, when I press too hard, what does it look like? It's really dark, my pencil lead breaks, I push holes through the paper, so that they pick up on those cues, and those are the cues that make them go, oh, it's true, I have to relax my hand. And so in those circumstances, then I might give them like a mechanical pencil. I might even give them a paper. Sometimes I do this, and I'll say that children don't love it. It's a hard challenge for them when they have a lot of pressure on the pencil or on the paper. I put the pencil on like a foam mat or even on a cushion, and their challenge is to finish the activity, you know, a coloring activity or a drawing activity, without making a hole in the paper. I often do this activity with something that's not handwriting, because I don't want it to be too cognitively overwhelming. I'll just give them, you know, coloring or tracing, a sort of simpler task where they can just focus on regulating that hand strength.
Excellent.
Okay.
Excellent. Any strategies for increasing the speed of writing?
So from what I've learned and what I've researched, I've tried to look into things. Often they talk about speed of writing coming with time, and coming with lots of practice, and coming with very clearly memorized letter formation. So when I see a child that's having a hard time with speed, often I'll look and see if there's things that are taking up a lot of attention or a lot of energy that might be causing the child to have less endurance or less motivation, or just less ability to write quickly. So that I would really, in that case, probably look at the basic skills. And depending on the child, while they're building up those skills, sometimes I'll talk to the parent and say, or talk to the teacher and say, listen, we want them, there's other kids that write way too fast, but they don't have neat writing. If my child is taking a little bit longer, but the writing is neat, often it's practice that they need. And of course you can play little games with, giving them targets and building up their speed, like try and, use a timer or something like that and get them to write a little bit faster if they're cognitively aware for that. But I would say often it's just lots of practice with regular writing, making sure that they have a solid baseline.
So at what age do we expect bilateral integration?
So there's many levels of bilateral integration, and it starts from, babies are moving, they're moving both limbs at the same time very often. So it starts with that symmetrical bilateral integration, and we develop towards more mature. But it's present through development, bilateral integration, and we just get better and better at it. I honestly don't want to lie and say that I know exactly the level, because I think that it's quite late that we really have fully mature. Like I'm tempted to say I've seen like 8 years old or something like that, and I could be completely wrong. So I think I won't say anything. I'm sorry, I don't know the answer to that when it's fully developed. But it's something that really, we have it all the time. It's just what quality do we have, and are we at the appropriate level for our age? And that the screening tool could be really interesting to explore that. Yes, I'm sorry, I don't have a better answer for that.
So Ravi also has a question. Can you explain the relevance of midline crossing in the day-to-day life in ADLs? How is it relevant?
Sure. So one of the big ones is dressing. If we think about helping get one arm into a sleeve, or lifting things, often depending on how you're lifting up clothes, sometimes you're crossing your arms over. So there's a lot of midline crossing, getting your two arms down to one side of the leg to pull the leg through. I would say in dressing, it's a huge thing. Also in things like washing. So if I need to wash this arm, I need to be able to get the other arm across and wash and the legs as well. In eating, it can also be, it depends on what exactly you're eating. But in activity, like something where we have to cut a little bit, we might have a little bit of midline crossing as well. But I would say definitely the bigger movements, things like dressing and washing, it's quite relevant.
Yeah. Does lazy eye impact handwriting? And there are just a couple more questions.
Okay. It can, definitely. It would depend on, like I would say, it would depend on the real visual skills. So sometimes when we have lazy eye, it can impact how much the eyes are working together and how much they're able to work together. And so then it can have an impact on how, it depends on the child. And I'm not an expert in visual issues, but sometimes it can be more tiring or more difficult to have the eyes, focused on a task and working together. And so it can impact just scanning and focusing on what I want to copy and then copying it on my page. And in comparing, looking back and forth and comparing what my model is and looking down at my hand, it would really develop, it would depend on if it's just that, if there's visual acuity issues, on kind of the whole profile of their vision, it could, I would say, in short answer.
So the next question is, how do we help children struggling with copying from the board onto the book?
Again, it would depend on the child's profile, like why they might be having that trouble. For some children, it's really more of a visual issue where they have a harder time to switch their focus from horizontal to vertical. So this going up and down and then following the lines can be challenging. So sometimes we'll explore with kind of a slant board or just a binder that's turned to the side so that we have the thick side away from the child and the thin side towards them, and their paper is kind of tilted up. So it makes it that their eyes don't have to do so much work in horizontal to vertical. So that might be something that I would explore. Definitely, I would look at vision and make sure that the child has clear vision and is able to see the board. And if it's an issue of that, finding their place and knowing where they are, then I would practice a lot of those kind of visual scanning activities like Where's Waldo type, in a busy environment, finding things and teach them to practice, left to right. I should be showing you left to right and top to bottom to be able to develop those skills.
So one last question.
Okay.
Would you teach letters A to Z or would you start with the specific letters? Super
interesting. Awesome question. You can see, sorry, in the program, Printing Like a Pro that I mentioned to you, they have free resources and they've broken it down in a way that to me is very logical, where they're really teaching groups of letters together as opposed to A to Z. So as an occupational therapist, when I'm teaching letter formation and I'm concentrating on teaching the motor skills, to me it makes much more sense to teach them in groups. So letters that start with a line down would be the letters that I would probably teach first, because that line is an easier movement than say the S. So I would start with T, L, B, all of those letters that start with that initial line, and then move towards maybe the magic C letters, if anybody knows Handwriting Without Tears. So I would teach them in categories. However, I understand that from a teacher's point of view, it makes a lot more sense to teach, maybe based on the alphabet, in the order of the alphabet, because they want the children to know alphabetical order. So it depends on who's, in what environment we're teaching, and it depends on what's the primary concern. Are we worried about the motor skills, or, are we worried about kind of the overall understanding of letters and reading and things like that? And so there's arguments on both sides. But Printing Like a Pro has kind of the breakdown of different letter groups based on the shapes and the movements to make the letters, and that's an interesting thing to check out.
I think each program has its own set of format that it follows. HWT follows a different format. Jolly Phonics as a program follows a different format.
Okay.
So each program follows a different format of how they teach letters.
Mm-hmm, absolutely, and how they group letters together, or yeah.
Awesome. So everybody has their video on. And everyone, y'all can please unmute yourself and talk to Kerri. It's lovely.
Hi, Kerri.
Hello, everyone.
Hi, Kerri. Thank you very much for your time. You're an excellent teacher. Thank you.
It's my pleasure. It's been really great. It's been a little motivation for me to kind of research and get up to date with all the skills. So I appreciate having that challenge as well.
Thank you.
Thank you so much, Kerri. This is Sonali
Thank
here.
you so much.
Yeah, I've attended all your webinars and it's been amazing.
Wow.
And this is a little off the webinar, but what I have been doing, my elder son who's 14 has been reading it, and you have kind of inspired him because he wants to come to Quebec to study. You've inspired him to do OT, to,
My
pursue.
gosh.
Yeah, I mean, I did want to tell you this today. So thank you so much. Thank you.
It's been a pleasure.
Amazing. Anyone else?
Yeah. Hi, Kerri. Anita here.
Hello.
Wonderful session. I mean, really very informative and insightful. So there are certain things we generally tend to overlook whenever we are doing things. So this is like a revision and an enhancement of everything, all the concepts. So fantastic. Thank you so much.
Fantastic. Oh, it's a pleasure. Thank you for the feedback.
Thank you so much. Thank you.
You're very welcome.
It's wonderful.
So
Hi, can you please show the bibliography, the references?
Yeah. So
Yeah.
couple of them wanted your presentation, the biography, the links, and I think Ravi, you also wanted the pom-pom slide, right?
No, what exactly does the pom-pom mean?
Oh, okay.
What is a pom-pom, you're asking?
Small cotton ball.
Yeah.
Yeah, exactly. A small. I can even bring one. I think I have one in my drawer. Would you like to see one? 1 second. I'll be right back.
So pom-poms are very small sponge kind of. Ravi.
Jasmeet, they are used for decoration.
Yeah,
and
they're used for
sometimes,
decoration. Yeah,
during this
right.
garba,
So-
people have on their, those dupattas.
Yeah.
Those are pom-poms.
It's like just a little.
Balls.
Yeah.
Like
Kind of cut off. It can be just a tissue. It can be a little toy.
So you keep it in between the finger, is it? Do you keep it?
So the goal is that we have one side of the hand that's the moving side and one side that's the stable side. And so some children haven't understood that concept yet. They haven't learned to stabilize with this side, and so their whole hand is moving, and they're using their forearm to stabilize. So if we want to start to teach them that we want to get those fingers moving, we don't want to only be using the wrist, then one thing that we can try is to encourage them to fold those two last fingers in and hold an object, whether it's a pom-pom or just a little figurine. Hold something in those two fingers, and then try, with the stability that gives in the wrist, try and just use their fingers to move the pencil.
Thank you.
That makes sense?
Thank you.
You're very welcome.
All right. So thank you, everybody.
Thank you, Kerri.
Overshot the.
Excellent webinar.
Thank you.
It's an awesome webinar. Thank you so much, Kerri.
You're very welcome.
We have just sent you a message privately. Would you mind having a look?
All right. Oh, and I'll just mention, for those of you, I've gotten some Facebook requests and things like that. I'll just mention that my Facebook I use as a personal Facebook. So if you want to communicate by Messenger, that's fine. But I'll also send you, you can communicate with me through LinkedIn, which is my professional profile. So you can always contact me through that as well. And I have a professional email that you can also contact me through. So if you add me on Facebook, I won't connect, but I'll send you a message with that information so that you can connect if you want.
So we will share that information with them as we share your stuff.
Perfect.
Thank you.
And
This
for
is
the
a
slides,
copy I would like to show you, if you could see.
I'm not sure that I'll.
Is it visible?
Let us broaden your view.
Oh, this is the paper. Okay, I see what you're talking about. Okay, my goodness, yes, that's a busy page.
Yeah.
So, Kerri, what we have here is, if you can have a look, is this, you know, the starting line is a red line. Then we have two blue lines and the red one.
Okay.
Not very visible. What I'll do is I'll take a photo and I'll send
Yeah.
it to.
But I completely, I do, thank you for showing, I do understand. I would say the other programs still work, and you can, you know, what I do is that I draw a little, you know, like I draw some grass on the grass line, and I draw some roots under, you know, in the ground line, and I draw a little sun or a cloud in the skyline. So even with those lines, it can still be appropriate. You can still use those different programs. But you just have to make sure that the child understands, you know, where to start. You can draw a little star at the beginning of each group of 4 and teach them, you know, this is the next one, this is the next one. Interesting. I didn't know that.
That is what I do as a strategy. I make a dot at every red line. Start the letter from.
Yeah. And the 4 lines that we have here, Kerri, actually the 4th line makes no sense, because we're starting from red, we stop at blue. The 4 lines, if we have, like, you know, the 4 red and blue lines, something like this, is 4. Okay, so you start from red, you stop at blue. So if we are highlighting, like what I do with my kids in the clinic is, I just highlight the first red line and the second blue line. We just do that much.
To have
So
like alternating.
Yeah, so they understand that it's starting from red and stopping at blue, and the lower line here is actually just, you know, it's just a base line. It's just, yeah, just ignore that line. If you have those 4 broad lines, this is how we do. Maybe different therapists are practicing a different approach, but this is what we practice in the clinic.
Okay. So everyone, this is the end of our 6-part series, and we've really enjoyed having you all over with us. Thank you so much. And Kerri, once again, a wonderful thank you to you.
It's been a pleasure. Thank you all for your time. It's been really, really interesting. Thank you.
Thank you so much. Bye, everyone. Take care.
Bye.
Bye.
Bye.